Alright guys, so now we're going to talk about bioterrorism. So what is considered to be bioterrorism? Well, it's a biological attack intended to release a virus, bacteria, or other germs that can sicken or kill people, livestock, or crops. Usually they find these in nature, but it's possible to have them mutated or altered in a lab to make them stronger or more resistant to any type of defense against it. So why would people consider doing bioterrorism? Well, it causes high rates of mortality, disrupts health industries, induces fear in the population, just causes general panic in the society, or they can use it to force the hand of a government. So, terrorist attacks in the past, not terrorist attacks, but events where these biological agents have come up in history. In 1984, the U.S. saw salmonella pop up in salad bars, had a big issue with that. In Iraq, in 1990, botulism toxin and anthrax spores were a big problem over there. Shingilla made its way into the food industry in 1996 in the United States, and then if you guys remember, in 2001, anthrax was a big problem with the mail industry. So what makes an agent ideal for bioterrorism is that it's easily available for laboratory use. It can be aerosolized or made into a spray form, or like you would know, aerosolized forms, easily inhaled. They're long-lasting and stable in the environment, making them easier to contract, and something that's not known to have a cure, something that you can't treat immediately. So routes for transmission, like we talked about earlier, being aerosolized, food and water contamination, and then direct inoculation. So the worst one is going to be aerosolized. They're invisible particles small enough to be inhaled. Any sort of spray or a gas or anything like that is going to be considered aerosolized, foggers, or an inhaler. There's three types: Class A, Class B, and Class C. We'll go over what all those are, how they're classed. Class A are easily transmitted. They have high mortality rates, large impact on the public health. These will include smallpox, Ebola, Lassa, Marburg, and anthrax. See the picture. Class B agents are going to have a little bit less mortality rate, but they're easy to transmit. Examples of these are Q fever, glandular salmonella, E. coli. C includes emerging pathogens that might be engineered, so they have to have some sort of engineering along with them, but they can produce a high mortality rate. SARS, hantavirus, or the H1N1. So the biggest one that we'll talk about, or that we've had in our lifetime anyway, is anthrax. So as you can see here, it's found in the soil, rod-shaped bacillus, but it can be transmitted through animals also. This is the one they had a big issue with in the mail industry through the envelopes. Anthrax spores are easily found in nature, can be produced in the lab, last for a long time. It's a good weapon, like it says, because it can be released quietly without anyone knowing. It has been used before as a weapon, 2001 again. Smallpox. I gotta adjust that slide a little bit. Smallpox. It was eradicated a long time ago, but before caused a lot of serious infections, spread from one person to another really easily. It was highly contagious. Most people with smallpox recovered, but about 3 out of every 10 people died. Again, successful worldwide vaccination effort, 20th century smallpox has been wiped out. No one has gotten smallpox naturally since 1977. Here's some pictures. There's no immediate threat of bioterrorist attacks using smallpox, but they've used it in the past to their advantage to infect their enemies. That's what it looks like. So there is a biosurveillance system that the United States uses, and it gives them real-time outbreak disease, or real-time look at outbreak. So they can collect data from many sources to determine where it's coming from, so the origin, and it can detect natural and man-made epidemics. So here's some examples of different PPE. This is going to be the more extreme side of it, but it can range from common masks like everyone's wearing today to a respirator or a gown and a suit. These guys have to have respirators and all that stuff. So here's a look at the role of the public health system. There's a little pyramid there. You can look through that. But this helps everyone be prepared for the next one. Biggest thing is having a plan, training, having agencies to call upon, time of need, knowing the proper resources. So this is just saying that the CDC works around the clock to help protect the United States, trying to detect threats early, get ahead of the game, and again, like I said, put plans into action before any issues arise.
Hi, my name is Dahlia, and I did the disaster portion. A disaster is an event that causes human suffering and demands more resources than are available in the community. Some examples of disasters are chemicals, hurricane and tropical storms, landslides and debris, thunderstorms and lightning, tornadoes, tsunamis, wildfires, winter and ice storms, and sinkholes. Some of the worst U.S. natural disasters of the decades were Hurricane Maria, which happened in Puerto Rico. There was a tornado outbreak in South and East in 2011, and Hurricane Michael, which we might remember in Florida 2018. So there are different stages when it comes to disasters, and the first stage is to try to prevent it. So mitigation activities at healthcare facilities reduce a potential hazard severity and impact before it happens. This can also be seen as cost-effective ways to improve readiness. Many activities are required by local, state, or federal laws. Now, disaster preventions. Some activities that can help prevent natural and man-made disasters are increasing surveillance, improving inspections and airport security, immunization, isolation, and quarantine. Some other ways to help prevent disasters in the communities is by strengthening barriers to help prevent flooding, to teach methods of preventing communicable disease transmission, and to identify and assess populations that are at risk. Now, it's good to, the second stage is to prepare. Disaster preparedness does not only occur at a national level, it also occurs at a state and local levels. So it's just important for professionals working in healthcare to know how to prepare for disasters. Some of the ways to prepare for these disasters is to create an action plan, find different methods of communication, determine evacuation routes, create a disaster kit, and plan meeting places in case a disaster happens. Some very popular emergency agencies that you probably are aware about are for example, American Red Cross, FEMA, and Emergency Management Agency. There needs to be a communication with these agencies in case something happens, so the community know who to call. Now, next is the disaster response. Different agencies are responsible for different levels of disaster response. Some of these are very well-known agencies that play a role in disaster response. You might be familiar with FEMA. American Red Cross is very popular also. So with the disaster response, there's an assessment. So with this assessment, the nurse is going to assess how many people are affected, how many are injured or dead, how much fresh water and food is available, what are the areas of risk, and are there any sanitation problems. Now, with classification, disasters are classified according to type, level, and scope. So the minor emergencies are the residential fires, livestock, barn fires, and localized chemical spills. The major disasters include large-scale floodings, hurricanes, and earthquakes. Disaster recovery, this stage begins when there is no longer any disasters, and now we're gonna go in to help rebuild. This can happen for days. This can last for days, weeks, or even years. Communicable disease and sanitation controls are important aspects of the recovery stage. Some risk assessment questions that are important is, what is the community disaster plan? What kind of warning system is in place? What are the populations at risk within the community? What type of disaster response are in place? What type of evacuation measures will be needed? And what kind of warning system is in place? Now, the nurse role in disaster planning is to develop a disaster plan based on the most probable disaster threats. Identify the community first responder and just make a list of agencies that are available for different levels of disaster management at a local, state, and national level. The nurse role in a disaster response is to activate the disaster management plan, perform triage and direct those affected. They coordinate the evacuation, quarantine, and opening of shelters. They triage those who have serious versus minor injuries and prioritize the care of the victims. The nurse role in a disaster recovery stage, they make home visits and reassess the healthcare needs of the affected population. They provide and coordinate care in shelters, and they provide stress counseling. And the evaluation of disaster response, at this stage, the nurse will create ongoing assessment. They'll estimate the length of time for recovery of community services, and then they'll evaluate how well the disaster response team did. Some fun facts that I found was in 2012, 905 natural disasters struck worldwide, including tornadoes, droughts, earthquakes, hail, floods, hurricanes, and wildfires. And floods are the most common natural disaster. Some special considerations is mental health, especially in the medical field. It's important for the nurses to take care of themselves, the doctors, while going through such a traumatic situation.
Hello, my name is Zachary Tyler, and I'll be doing the first half of the communicable diseases PowerPoint section. So, to begin, what is a communicable disease? Communicable diseases are illnesses caused by viruses or bacteria that people spread to one another through contact with contaminated surfaces, body fluids, blood products, insect bites, or through the air. So how the disease spreads, there's 4 main reasons why. So the first one is physical contact with an infected person. Secondly, contact with a contaminated surface or object. Third, traveling through the air. And fourth would be bites from insects or animals capable of transmitting the disease. So some examples of communicable diseases is COVID-19, which Nick will be talking about later in this PowerPoint. And we have Ebola, the flu. I'll be talking about hepatitis A and hepatitis B, and HIV and AIDS also as an example. So traveling and prevention of communicable diseases, the CDC website has an awesome way to see what vaccinations are recommended for travelers and healthcare professionals when traveling anywhere around the world. It really is a really great resource, and all you have to do is just put in where you're going anywhere around the world and your exact destination. It will show you a list of all the vaccinations that they recommend. So talking about vaccinations, vaccinations against a range of bacterial and viral diseases is an integral part of communicable disease control worldwide. Vaccination against a specific disease not only reduces the incidence of that disease, it reduces the social and economic burden of the disease on communities. Nurses' role in a communicable disease, I'll be more talking about the teaching aspect. Nick will be talking about any other factors of it. As far as teaching, a nurse can always brief where they work on a communicable disease that is flaring up or is new to the current world, like COVID-19 is. Even by the letters we have wrote to the residents in the long-term care facility, it is a great way to educate people and hopefully prevent them from acquiring a disease. So the correct PPE for a nurse to wear, there's 3 main categories. First one is airborne, secondly is contact, and third is droplet. Nick will be talking about how to don and doff all the PPE required for each one of these categories. So the first check on learning, how does a communicable disease spread? A, physical contact, B, contaminated surfaces, C, airborne, or D, all of the above. I'll give you guys a few seconds. So the answer is D, all of the above. So this trick question, kind of like the NCLEX, didn't tell you which type of disease it was. So going off of that, it would be all of the above because you don't know. Any disease can be a different type of category. So the first one is hepatitis A, and it is caused by a virus that infects liver cells and causes inflammation. And inflammation can affect how your liver works and cause other signs and symptoms of hepatitis A. For some of you who may not know, hepatitis A is preventable by vaccination. So causes of hepatitis A. The virus most commonly spreads when you eat or drink something contaminated with fecal matter, even just tiny amounts. It does not spread through sneezing or coughing. Side effects of hepatitis A: fatigue, sudden nausea and vomiting, loss of appetite, low-grade fever, dark urine, and jaundice, just to list a few side effects of hepatitis A. So the prevalence in the United States, exactly, hepatitis A, we have 12,474 new cases reported and 3.8 reported cases per 100,000 population. So you'll see here in a bit that hepatitis B is right around the same as hepatitis A. So hepatitis B is a liver infection caused by hepatitis B virus. It is spread when infected blood, semen, or other body fluids enters the body of a person who is not infected. So causes of hepatitis B is sexual contact, sharing needles, other drug injection equipment, and from mother to baby at birth. And the virus can spread from an infected individual even if they do not look or feel sick, kind of like COVID. Side effects of hepatitis B, to list a few, there's fever, tiredness, loss of appetite, nausea, vomiting, jaundice, almost the same side effects as hepatitis A that I just went over. So the prevalence in the United States for acute hepatitis B for 2018, 3,322 new cases reported, 1 reported case per 100,000 population, and 21,600 acute infections estimated. And thousands of people die each year from hepatitis B. So the second check on learning, how is hepatitis A transferred from one individual to another? Is it A, airborne, B, fecal oral, C, infected needle, or D, both B and C? I'll give you guys a couple seconds. So the answer is D, both B and C. And this concludes my part of the group project.
Professional responsibility with communicable disease, with a special focus on COVID-19. What is COVID-19? Well, it's a coronavirus. And there are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illnesses. COVID-19 is a new disease caused by a novel coronavirus that has not previously been seen in humans. The COVID-19 affects different people in different ways. Infected individuals have a wide range of symptoms reported, from mild symptoms to severe, life-threatening illness. How do we spread COVID-19? The virus that causes COVID-19 is thought to spread mainly from person to person, often through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. Spread is more likely when people are in close contact with one another, within roughly 6 feet. Symptoms may appear anywhere from 2 to 14 days after exposure to the virus and may include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion, nausea or vomiting, and diarrhea. It is also important to note that some people who have contracted COVID-19 will remain asymptomatic, but can still spread the virus. So how do we protect ourselves? Well, the best way to prevent illness is to avoid being exposed to the virus. While this isn't always an option for the healthcare provider, there are other practices to help prevent the transmission and spread of COVID-19. Because person-to-person transmission through respiratory droplets within a radius of roughly 6 feet is currently thought to be the main way the virus spreads, everyone, including healthcare providers, can reduce the risk to themselves and others by wearing a mask, practicing physical distancing, and washing their hands often. We must also protect our patients by staying up to date on the latest evidence about the risk for patients with underlying medical conditions, knowing your patient's overall health and how well their conditions are managed. Help patients manage their underlying conditions to the best of their ability, and encourage them to take medicines as prescribed and ensure that patients have sufficient medication and supplies. Encourage all patients, regardless of risk, to take necessary steps to protect themselves. COVID-19 and the healthcare system. Well, the COVID-19 pandemic has changed how healthcare is delivered in the United States and has affected the operations of healthcare facilities around the world. It is our responsibility as healthcare providers to adapt to a changing environment while continuing to provide necessary care for our patients. Some of the changes we are seeing include an increase in patients seeking care for respiratory illnesses that could be COVID-19, deferring and delaying non-COVID-19 patient care, interruptions in supply chains for essential supplies like PPE, absenteeism among staff because of illness or caregiving responsibilities, and an increase in mental health concerns for not only patients but caregivers as well. Additional stresses placed on the healthcare providers will include physical strain of the protective equipment, physical isolation, constant awareness and vigilance regarding infection control procedures, pressures regarding new procedures that must be followed, and additional stress on time management skills and patient prioritization. It's going to be incredibly important to be aware of your situation as a healthcare provider. because the well-being and emotional resilience of healthcare workers are key components of maintaining essential healthcare services during the COVID-19 pandemic. If necessary, healthcare providers may need to meet with leaders in their departments to discuss the importance of stress management and psychosocial support in the workforce during this unprecedented time. So what's next? Well, communicable diseases have dramatically influenced the way that we deliver healthcare in the past, and the COVID-19 pandemic will prove to be no different. COVID-19 has brought a new awareness to the fragility and the vulnerability of our current healthcare system, and has many healthcare systems rethinking the current approaches used to treat patients who contract communicable diseases. The COVID-19 has simultaneously created a surge in demand for healthcare due to spikes in hospitalization and diagnostic testing, while threatening to reduce clinical capacity as healthcare workers contract the virus themselves. Oh no! Staffing shortages and provider burnout has proven to be an enormous problem when dealing with COVID-19 and all of the associated problems that have come with it. As the families of hospitalized patients are oftentimes unable to visit their loved ones in the hospital, the role of each caregiver is expanding. This increased mismatch between patient needs and provider capacity highlights one of the most pervasive inadequacies of the U.S. healthcare system. Identifying and creating solutions for the most basic of problems associated with the COVID-19 pandemic will be on the top of the list in order for healthcare systems to improve and remain effective during this unprecedented time. Proper use of PPE has always been important, and it will continue to be important. As healthcare providers, it is our responsibility to be competent and confident in the best practice for the proper use when dealing with communicable diseases, including COVID-19. This means fully understanding when to use PPE, what PPE is necessary, how to properly don, use, and doff PPE in a manner to prevent self-contamination, how to properly dispose of or disinfect and maintain PPE because we don't have enough, and the limitations of the PPE that you have selected to use. When dealing with COVID-19, preferred PPE is going to be using an N95 mask or higher respirator, clean non-sterile gloves, face shield or goggles, and an isolation gown. If N95 or higher respirators are not available, face masks are an acceptable alternative. Donning of PPE is one of the most basic skills healthcare providers should be comfortable and confident knowing how to do. Properly donning your gown, mask, goggles, and gloves will provide the necessary protection when dealing with patients who have a communicable disease. Doffing your PPE is no different. Being aware of how you are doffing your PPE in order to prevent contamination of yourself, your coworkers, and other patients will be of paramount importance when dealing with patients who have contracted communicable disease. I cannot stress again the importance of the proper doffing of your PPE, which includes respirators, face shield and goggles, gown, mask and respirators, and gloves. So where is all this going? The future of communicable disease. As the human population continues to rise and the practices of agriculture and industry rapidly replace sustainable alternatives in developing countries, the risk of creating and spreading communicable diseases throughout the world will only increase. Understanding the repercussions of this type of progress will be paramount in understanding how and why some of these diseases are able to have such an impact on the human population. Another important area of interest is the overuse of ineffective antibiotics in the treatment of certain medical conditions. It has been very clear throughout the scientific community for many years that the widespread use and overuse of antibiotics has led to the evolution of so-called superbugs. And if these superbugs are allowed to spread their wings and unleash their wrath on human populations around the world, these indiscriminate organisms will no doubt make the COVID-19 pandemic look like a regular flu season in Antarctica. What have we learned? COVID-19 has certainly opened our eyes to the shortcomings and oversights of not only our healthcare system, but also to our way of life as a species. We need to rethink the way that we live, the ways in which we interact with each other. We should rethink the practices that have come to be social norm in healthcare and everyday life, and most importantly, how we think about each other.